Congenital spherocytosis is a hereditary blood disorder. It causes red blood cells to be spherical instead of their normal disc shape. This abnormal shape makes them fragile and leads to their early destruction, a process known as hemolysis.
Let's proceed to the pathophysiology of this disease. Certainly, congenital spherocytosis is a condition characterized by a primary defect in the red blood cells membrane and cytoskeleton, leading to the formation of rigid spherical cells called spherocytes. These spherocytes are recognized as abnormal by the spleen and are removed the circulation through the phagocytosis, causing extravascular hemolysis due to their abnormal shape. Spherocytes have decreased surface to volume ratio and decreased deformability, impairing oxygen delivery to tissue and contributing to anemia. Additionally, spherocytes become trapped and secreted in the spleen, microcirculation further exacerbating anemia. Sign and symptoms. Patients with congenital spherocytosis typically experience anemia, which cause fatigue and weakness. They may also have jaundice, leading to the yellow of the skin and eyes due to the increased bilirubin. Another common symptoms is splenomegaly, wherein the spleen enlarges because it overworks to remove the abnormal cells. And also gallstones can also form due to elevate the bilirubin levels. Let's proceed to diagnostic test. Reticulocyte count high levels indicate increased red blood cells. Blood smear shows round red blood cells. CBC identifies anemia. Family history checks for hereditary patterns. Also, we have bilirubin levels. High levels suggest increased red blood cells breakdown. Genetic testing identify the mutation in red blood cells membrane genes. Osmotic fragility tests parasites bruise easily in hypotonic solution. Management of congenital parasitosis involves several approaches. First is genetic counseling helps family understand the hereditary nature of disorder. Second, regular monitoring of blood counts, bilirubin levels, and spleen size are essential. Nursing intervention include providing emotional support and monitoring for complications like anemia and jaundice. For treatment options include folic acid supplements, blood transfusion, splenectomy, cholecystectomy, vaccinations, and regular monitoring. Pharmacologically, patients might receive folic acid to support red blood cells productions and pain management for symptoms. Lastly, the prognosis. With appropriate management, individuals with a congenital spherocytosis can lead normal lives. Regular monitoring and supportive care are crucial. The long term outlook is generally good, though it depends on the severity of disorder and the presence of complication like gallstones.